Namaskaram, Sadhguru. Sometimes spiritual experiences seem to involve a weakening of the ego, which may appear similar to psychosis. Like Ramakrishna Paramahamsa was called a mad priest due to his ability of seeing Ma Kali. How can we differentiate a patient suffering from mental illness from a spiritually advanced personality? Similarly, we do see patients who practice unsupervised advanced Kundalini yoga practices and then end up developing mental illnesses. What may be the best yogic way of dealing with such patients?
First thing is, will you be able to identify between those who are spiritually mad and just regularly mad? The identity or how to identify this? Well, Nimhans Institute is a premier institute in the world, in Bangalore, and I know they have done tremendous amount of work for the mental health of, I don't know, millions of people probably. It's one of the prime institutions in southern India at least. So, how to identify and then how to treat? Now, one does not need treatment. Those who are spiritually mad don't need treatment, they need an ambience to establish their madness. Right now, their madness may be little erratic. They need to get well established in their madness. Let's understand the word madness. Madness means essentially anything that is not logical. If somebody speaks or does something which is not logically correct in your understanding, immediately you will say he's crazy. So anything that does not fit into your understanding of life, anything that does not fit into your logical limitations is madness in your understanding. Many of you think your children are mad. Children know that you're mad. Yes. So, how do you identify someone who may be well, you're talking about dissolution of ego, okay, that's how if you want to see it. Essentially, why a person on the spiritual path may look little mad to somebody is because of the sense of abandon, which is, the words that you put in terms of dissolution of ego just means that, in a way, that there is a sense of abandon. That means you're kind of not too concerned about what happens to this one. Well, when I say what happens to this one, this is one thing that you can be sure of. People who are in mental conditions, that is mental illnesses, or those who are under influence of narcotics or alcohol or something, they also lose their logical sense, but in a destructive way. That is, when somebody is on LSD or somebody is in a mentally deranged state, they could easily cause physical harm to themselves. But one who is spiritually crazy will never cause physical harm to themselves. I'm saying they're smartly mad. They are only dismantling the mental structures. They know clearly that physical structure cannot be dismantled because if you dismantle it, you can't put it back. But a mentally deranged person does not know this. One who is under the influence of narcotics do not know this. They can physically dismantle themselves, in the sense, there have been many cases where drunken people or drugged people or even mentally deranged people have jumped off buildings or mountains or whatever high places. That never will happen with a spiritually crazy person. because they clearly understand what needs to be dismantled is only the mental structure. You cannot dismantle the physical structure, because if you undo the physical structure, you can't put it back. So that is one sign. When there is no any kind of sign of causing physical damage to oneself, that is one sign. Another thing is, if someone is mentally deranged, one thing is they cannot sit still. But one who is spiritually crazy, if you make him or her sit still, they will sit still for hours on end. So these two can be kind of guiding factors. If you ask someone to simply sit still with eyes closed, that is not possible for one who is in a mentally aggrieved or exaggerated state of mental, activity. Sitting still, closing eyes won't come. But it is good to avoid spiritual madness also, because then you will need an ambience of caring people who understand what's happening within you and create a protective atmosphere. So going spiritually crazy, those days are gone. You need to be just little crazy in your head, but very balanced and sane in the world. Otherwise, it's not going to work, because there is no supportive atmosphere like that anymore. Even here, these days, nobody takes it. So, what or how can we treat them? Well, if one is spiritually evolving and at a certain moment or a certain stage of evolution, one looks little out of sorts, please don't treat them, because treatment means, what treatment will you give? Generally, the treatment is only of sedation, bringing down life. No, that's not the way forward. Definitely, that is not the way to handle this. I must tell you this, this happened many years ago. The doctors in Nimhan, I'm saying this with utmost regard and respect for your work, because I know how many lives you have transformed and how many lives you've saved from total derangement. So there was a young boy in Bangalore, and he was only 17 or 17 years of age, I think, at that time. So he became mentally imbalanced and he was admitted to your institution, Nimhans. I'm talking about late 70s. He was admitted to your institution for, I don't know, maybe 2 weeks or 3 weeks or something like that. Then he came back quite normal and fine, just as crazy as a 17-year-old should be. But the local boys wouldn't leave him alone. They went on saying, "Hey, you went to Nimhans, you're crazy." Because in Karnataka at least, who generally youth who know about Nimhans, if they want to insult somebody, they say, "Oh, he's a Nimhans case." That means he's lost his mind. So they went on harassing him that, "You've been admitted to Nimhans, so you're mad." So one day this boy came, I don't know if it was a genuine thing or he wrote it up himself, I'm not sure about that. He came and pulled out a paper and he said, "See, I have a certificate from Nimhans that I'm normal, do you have?" Of course, nobody else had. So, thank you for all the work that you're doing, and the chances of spiritually crazy people coming to you are very remote, unless there is a very aggressive and inhospitable atmosphere around them and somebody catches hold of them and brings them to you. By themselves they will not come, because they are not suffering it, first of all. But there could be other kinds of people who come that they did spiritual practices irresponsibly by reading a book or taking wild instructions from somewhere and doing their own thing, and they lost their mind. They're just crazy. There are many ways to go mad. Every human being has 1,000 opportunities in a day to pull their mental structure down and become deranged. Yes, you can think yourself into madness in so many different ways because the line between sanity and insanity is so thin in everybody's mind, I'm telling you. It is extremely thin. If you push it, you may cross. So, people doing improper spiritual practices and losing their mind and coming, don't treat them as spiritually crazy, they are not spiritually crazy. They use spirituality to go crazy. But they're just mentally deranged, they must be treated as you medically feel it is fit to treat them, depending on what level of imbalance they have. So being in a state of abandon and people mistaking that you're crazy is different than doing improper spiritual practices. Improper intellectual activity can lead to madness. Similarly, improper spiritual practices can lead to madness. Improper physical activity can lead to madness. If you just breathe in certain ways, you could lose your mind. There are ways to do this. This is not a time to instruct you in those things. Why? Why we are taking so much care about how to breathe, taking hours and hours to teach you a simple way of breathing is because our breath, how we breathe could… and our physical body, how we move it, what we do, could decide the chemical nature of our existence. The chemical nature of our existence will, in many ways, and as you know as doctors, definitely determines our mental status, whether we are sane or insane. If there is even a branding like that, in the society there may be, but I don't think medically there is a clear-cut branding that somebody is sane, somebody is insane. The question is only, some people are in a socially accepted level of madness, some people have crossed that. So what is crazy, what is not crazy is more a social description, not really a scientific description as such. So, this process of treating people according to their problems or according to their sufferings is left to you, but either doing wrong type of physical activity, mental activity or spiritual activity can cause derangement of mind. So, this is what yoga is about, to even learn to sit properly. You know how long it takes to make people understand how to sit properly. Oh, it's unbelievable. So-called well-educated, intellectually sharp people, it takes so long to make them understand how to sit. How to breathe is many more years. How to keep your mental structure, oh, that's another thing. This, as medical professionals working in this region, we would like to work with you if that is necessary, but you yourself can do this probably. How to bring certain aspects of yogic culture into our education systems in the world is most vital. That is, if you want less number of people coming into these institutions, so that these institutions are kept for those people who most need it, not all kinds of frivolous people entering and taking that space. This needs to happen. Only then those who really need it can get a good level of or a high level of treatment.